Okay, yeah, hello everyone. It's a pleasure to be here today to talk about MI-Bot, a simulated motivational interviewing counselor for smoking cessation. My name is Osnat Melamed. I'm a physician and a scientist with Intrepid Lab at the Center for Addiction and Mental Health, and also an associate professor with the Department of Family and Community Medicine at the University of Toronto. And yeah, speaking to you this morning from Toronto, you can see here a picture of our downtown core situated on beautiful Lake Ontario. We got our first snowfall of the year, so it's pretty chilly here at the moment. I have the grant funding and salary support from these organizations, but no ties with commercial or for-profit entities. And I'm excited to share MI-Bot on behalf of a larger team that develops this intervention. It's a brainchild of the two folks in the middle, Peter Selby, who many of you know, Professor Peter Selby as a tobacco cessation specialist, alongside Professor Jonathan Rose, who is responsible for the engineering development of the chatbot. So we have very similar problems that we're trying to tackle with smoking cessation chatbots. Ours is a bit more proximal. We are targeting people who have low motivation to quit. In Canada, we know that there are about 3 million Canadians who smoke, and only about 5 to 10% are able to quit each year. And many of them have low motivation to quit. It could be due to various reasons, and therefore many of them do not attempt to quit or use effective treatment. And here comes motivational interviewing as a counseling approach that can actually work with the person who is smoking and increase their motivation to quit. So a little bit about motivational interviewing approach and how it works, why it can increase motivation. So the motivational interviewing conversation is an empathetic, non-judgmental one, and it explores a person's ambivalence, which means that if I'm a person who smokes, I have reasons that I want to continue smoking, but at the same time, I have opposing reasons for wanting not to smoke, basically wanting to quit. And through this conversation, the goal is to elicit my intrinsic motivation to quit smoking. And this is done through very specific language skills that are unique to MI, which are open-ended questions, affirmations, reflective listening, and summaries. Due to the brevity of the presentation, I won't be able to go into too much detail about those, but they're of course available in the references here. So we talked about how motivational interviewing could be helpful for people who want to quit smoking, but we know that there aren't enough trained MI counselors. And this is because it takes quite a long time to learn and practice and get the experience of a seasoned motivational interviewing counselor that usually have the best outcomes. And this is particularly true in non-academic settings that we don't have access to those counselors. And our aim with the MI-Bot is to automate the motivational interviewing counselor. And I'm glad to have gone second in this webinar because Lauren has already, thank you, Lauren, for presenting some of the backgrounds. I don't need to go into too much detail, but we do know that we have a digital opportunity with generative AI large language models. They have the potential to deliver behavioral change counseling. They can be trained in the specific MI language techniques that we know can explore patient ambivalence. And through this conversation, the chatbot could elicit change talk, which is exactly why the patient wants to quit smoking. What are the reasons that appeal to them for wanting to quit? And as a result of this conversation, we hope to help move patients towards the decision to quit. So this is usually just an entry point into treatment where people increase their motivation, later on engage in treatment. So today I'll present the work that we've done in the past year, and this was recently published in June of 2026, a fully generative motivational interviewing counselor chatbot, moving smokers towards the decision to quit. And the first authors here on this paper are the graduate student in Professor Rose's lab that worked really hard to program our chatbot. So this is an overview of the MIBot system and how it works. So very clearly, you can see that there is a client that converses with the counselor. And the client would say, for example, I fight the urge for some time, but end up not winning. I sometimes sleep to avoid feeling the urge of smoking. And then this goes into the counselor chatbot, and the counselor responses with, it takes a lot of strength to fight those urges. And it's understandable that it can be exhausting to maintain, which is a pretty good response. And in the MI language, we call it a complex reflection, which the client hears back his thoughts, plus it adds a bit of a sentiment that the counselor understood, such as that the process of smoking cessation can be quite tiring or exhausting. And the conversation goes back and forth. We have a couple of observer, which are programs that run on the side. I think Lauren mentioned those too. If we want to have the conversation that is on track, we have a program that sees that the topic doesn't veer off to other other topics that the client may want to talk on. If they want to end the conversation, we want to pick up on that and not continue talking. And we also have a moderator, and in our case, that tool was meant to help seeing that the conversation is helpful towards quitting smoking as opposed to sustaining smoking. And we also had some keywords to identify if there are any concerns around self-harm for the client. And our MIBot, I should say, was based on OpenAI's GPT-4o. I'll just move it. I just wanted to mention that the background, the counselor, the programming that we did in order for the counselor to be effective in delivering motivational interviewing counseling is through a prompt. And again, Lauren mentioned a little bit about that. So in order for the program to be able to provide motivational interviewing counseling, we need to advise it what to do. And this initially started with a very short prompt. You are a skilled motivational interviewing counselor. And then through iteration, we saw what we were getting. For example, one of the things we noticed right away is that the chatbot had a tendency to be very verbose, very, very long answers. So the next iteration, it would just give it instructions to be a little bit less verbose and let the client talk a bit more. So this was the work that we did through iteration until we found a prompt that we were happy with. And once we had a prompt that we were happy with, we had the MIBot ready to be tested. We took it to Prolific, which is a crowdsourcing platform. And we had our inclusion criteria here. We specifically targeted individuals that had lower confidence to quit, 5 or lower. And we included 106 participants, mean age of 40. And we gave them the MIBot to converse with. So this is a scheme of what happened in the experiment. So people would come on to the conversation, sign a consent, provide some demographics, and tell us their confidence to quit. They then conversed with the chatbot, with MIBot, for an average of 19 minutes. And following the conversation, they provided feedback, they filled in the confidence to quit scale, and also told us if they thought that the chatbot was empathetic. And 1 week later, we returned to those participants and they told us again where their confidence is. The results of the MIBot was quite encouraging. We were looking into the effectiveness of the MIBot in increasing motivation to quit. And we saw a signal that showed that the confidence increased, started at 2.8 and increased to 4.5 1 week after the conversation. You can also see the distribution here, that about 60% of people their confidence increased. 28% did not show any change. And there was a small proportion, 12% of people, that their confidence actually decreased after talking with the chatbot. We also wanted to see the acceptability of this, the perceived empathy. So the chatbot got pretty good scores with that. And we see that we got a lot of compliments saying that the chatbot was friendly, understanding, helpful, caring. But at the same time, we know that some people, and those are smaller words, meaning less frequent, gave him not the best compliments, such as being boring, simplistic, disappointing. So we can understand that this is not, not everyone can engage with this intervention, but most people really like it. We also tested the MI adherence, and we wanted to know whether the MI bot language was consistent with motivational interviewing, and that also scored pretty high, meaning that chatbot was able to follow those instructions. It's just some summaries of this experiment and some next steps. So this was an interdisciplinary collaboration working closely with our partners in engineering to develop a fully generative AI chatbot. It's meant to mimic an MI counselor and uses specific MI skills. And what we saw is that interacting with MI bot was associated with an increase in confidence to quit. And of course, we should caveat that this was not a controlled experiment. We did not have a control group to compare. And the overall participant feedback was quite positive. We had most of the people being very happy with it. And our next step with regard to the development is take it one step further and saying, okay, one session looks pretty good. We should probably take it into multiple sessions. So we're now looking into MIBot 2, two-session chatbot. It's in development. And we are preparing to test it in a randomized controlled design, therefore having a better sense of the effectiveness that it can lead to. And I think that's it. Those are my slides. So thanks very much.
Great. Many thanks for that great presentation. So we've got one question in the chat, which is, would it be possible or useful to adapt the answers to the educational level of the participant? Would that be possible?
Yeah, thanks very much. This is a really great question. I think that what you are referring to here is adaptation to the specific needs of specific groups. I think that definitely that's one of the strengths of digital tools like the MI bot, that it can be adapted, and you could do that with prompting the bot, for example, to use specific, more lay language and break things down to be more simple and clear. I think that once we have a robust tool that we have tested, a prototype, we can later tailor it to specific groups. If it's, for lower education, particular groups. Yeah, absolutely.
Yeah, one of definitely the benefits of this and the kind of what it can do. Okay, a few more questions. So what do you mean by 2 sessions?
So I'm sorry if I wasn't clear by talking about 2 sessions. So our chatbot intervention, it was comprised of a single session with the chatbot. So people came to the chatbot, conversed on average for 19 minutes, and then we approached them 1 week later to see how their confidence, where their confidence level was. When we're talking about 2 sessions, we want to have one session. Let's say today is a Thursday, so you're having a session today, and we're scheduling another session in 1 week from today, next Thursday, and we're going to come back to you the following. So in 2 weeks after the first session, we'll come back to see how you're doing. So it's a multiple session. We hope to mimic something that's happening in real clinical practice, where people come back to their counselor or their physician week after week for additional counseling.
Great. That actually answers another question, which is, can you describe more how you envisage using MI bot in a clinical setting? So that speaks to that.
Yeah, Absolutely. I think the multiple we so there is quite a lot of evidence about brief intervention that could be just a small one-time conversation, but usually the brief interventions, although they are effective, their effect size is relatively small. But we do know that once we have multiple sessions with extended durations, we can see a larger effect. So we were hoping that's what we were aiming for, to have a larger effect, to have people come back and not just increase motivation, but then what do I do next? What are those behavioral changes? Do I need a medication? That could
Yeah.
take quite a lot of sessions. Yes.
Okay, great. So we'll leave it in there for the questions, but there are other questions in the Q&A, Osnat, if you've got
Okay.
a chance to answer some of
Sure.
those, try and pick up. I'm trying to summarize as we go along if there's anything we need to pick up at the end as well. But
That,
thank you very
that
much
will do.
for your work.
Thanks very much.